Eligibility and coverage. Eligibility and coverage benefits are very important to us. Eligibility and benefit coverage is the difference between your provider working for free and your provider getting paid for the services that they would like to render or have already rendered. It is very important in every practice that some sort of eligibility of active coverage and benefit of care is done. Again, it is very crucial in terms of reimbursement. If a provider does not go through the proper eligibility and benefit verification, they may be in a position where they have provided care to a patient that they will never get paid for. Eligibility. Eligibility means active coverage. Either an insurance policy is active or it is terminated, means it has ended. It is very important that you always verify a patient's eligibility to make sure that their insurance is covered. Insurance change all the time with patients. They change jobs. The jobs change insurance plans. So eligibility is very important in making sure that your billing and the care that you provide is accurate. Benefit coverage is important because some services are just not covered by the insurance plan, and you want to know that ahead of time. You want to know what is covered prior to your provider providing a service that is not covered and they will not get paid for. I will take some time to go through the different types of insurance plans, benefit levels, and coverage and show you an example. It is important that every time you call to get benefit and eligibility, you do a number of things. Item 1, make sure that you get the effective date and or a termination date. Item 2, make sure that you get both in-network and out-of-network benefits. Make sure you receive a breakdown of patient responsibility. Make sure you ask and get a direct answer to if a service requires authorization. And lastly, make sure you take down that person's name, date, time of call, and a reference number. These are all things that will later protect you in ensuring that the services are being covered. So, coverage and benefits, the financial benefit level. Each patient will have an insurance policy where they will have some sort of financial responsibility in order for the insurance company to pay their claim. Most common is a copay. A copay is a flat dollar amount that are usually subject to office visits and prescription drugs. A deductible is also a flat dollar amount that must be met before insurance will pay anything on the claim. The deductible is usually subject to hospital care, x-rays, most things that are outside a regular office visit. Coinsurance is a shared percentage. So out of 100%, the insurance company is required to pay a certain percent, and then the patient is then required to pay a certain percent. Example, out of 100% coverage, the insurance may pay 70%, and the patient would then be responsible for 30%. Out-of-pocket maximum. This is a flat dollar amount that combines the deductible and the copay that the patient pays out, and when that dollar amount is reached, their services are covered at 100%, which means for that calendar year, When their out-of-pocket max is met, the patient is no longer responsible for a deductible or co-insurance. A lifetime maximum is a flat dollar amount in some cases where the insurance company states, after we've paid this dollar amount, we will no longer pay any additional claims on your behalf for the lifetime of your policy. Most insurance policies are unlimited. Types of insurance. There are a number of types of insurance policies, one of which is a group policy. Group policies are normally policies that you pay a portion of through either an employee-employer relationship or an association. An individual policy is a policy that you call the insurance company directly. You pay the premium on your own. A Medicaid policy is also known as a state policy. A policy in which is normally approved by income or disability requirements. Medicare policies are a federal government policies that are issued to elderly and the disabled. The Medicare policies are broken down into 4 separate sections. Part A for hospital, Part B for office visits, Part C for Medicare Advantage, and Part D for medication. A Medicare Advantage plan is a Medicare plan that has partnered with a commercial policy. So you may have Blue Cross Blue Shield regular, and for the Medicare Advantage plan, it would be Blue Cross Blue Shield Advantage or Senior Care. Then you have the VA benefits for veterans, and the most common, which are the commercial policies, such as Blue Cross Blue Shield, Cigna, United Healthcare, Aetna. Each policy is broken down by a care coverage, which means based on that particular care coverage, organization determines the type of leeway you have within that policy. If you have an HMO policy, you are unable to see other specialists or physicians without your primary care physician giving you the approval through authorization or referral to do so. A PPO policy is the total opposite of an HMO policy. This type of policy will give you the freedom to see whomever you like without the approval from your primary care physician. A POS policy is a blend of both an HMO policy and a PPO policy, which means in some cases it is more like an HMO policy than a PPO policy. High deductible health plans. These have become most common because employers have now been forced to provide insurance benefits. A high deductible plan means the employee pays less out of pocket, or the patient pays less out of pocket for their premiums, for more out of pocket for their care. Remember, when you have a deductible, your deductible is required to be met before insurance pays anything on your plan. Now, your insurance card, a insurance card, can be very helpful. The front of the card is going to provide you all the information you need for billing. Patient's name, ID number. It's going to let you know what type of plan it is, whether it's PPO or HMO, which will then let you know if authorizations are needed. It may even give you a copay or a deductible amount. On the back of the card, it's going to provide you the claims address or payer ID, the member's phone number, the member service phone number, or the provider phone number for claims, eligibility, and authorizations. Let's take a look at an insurance plan. Okay, we're going to click on the ID number for Mr. Lloyd Hopkins. As you see, his plan type is an HMO plan. It provides an effective date. It has a present termination date, which means it is still active. Information on where claims should be sent. And provider phone numbers. Here you have the individual deductible for in-network benefits, which 0 has been met. It has the out-of-pocket, the co-insurance, and the lifetime max information. Because this is a HMO policy, he only has in-network benefits. There are no out-of-network benefits. Below, you can see the different services that are covered by his insurance plan and at what financial responsibility. Chiropractic care is $30 with a maximum of 24 visits per year. Hearing aid covered at 100%. Now, each website will be different in terms of what information it will provide you. It is important that if you do not walk away with the full understanding of what is covered and the financial responsibility for the patient, that you call. Again, there are 5 things that you need to do. Whether you receive this information over the phone, online, or using a fax system, you do need to know if the coverage is active. You need to know the deductible information, how much the deductible is, how much of it has been met, how much is remaining, if there is a co-insurance amount, what percentage is that, if authorization is required, if it is a major service or surgery, if that particular service or surgery is covered. And then you always want to make sure you document where you receive this information from. Again, benefits and eligibility is very crucial to the success of a practice. Make sure you retain all the information that you need to make your provider successful.